they jump and put millions of dollars wherever they want.
Plenty of other cities have passed sick leave. We're more than capable of doing it. We hospitality workers bring in billions of dollars in revenue that would never reach this city otherwise. Many, many other workers across the country have been fighting for this. Other states have passed it. There's no reason that New Orleans, the #1 tourist destination in the world, can't have paid sick days for tourism workers, for hospitality workers, for servers, bartenders, cooks. If we don't have sick leave, if we don't have health care, we get all of the customers and our coworkers sick. You cannot stop the spread of an infectious disease, including the flu, which we already spread throughout our workplaces on a weekly basis, unless you give us the paid sick leave, health care, and free testing that we need to properly address this situation.
Hi, everybody. Thanks for being out here today. And for the group that is here, we appreciate hearing from you. I know we spoke a little bit in the hallway already.
You made no promises.
We did not. No, we're not in a position to make a promise. That is correct.
Right.
So one of the things
They don't
that...
think that meeting with workers to discuss serious public health issues is important enough to make time for in their daily schedules.
No, ma'am, I'm sorry.
None of
That's...
the preventative measures
Pardon me,
that they
ma'am.
have put forth have included paid sick
That's
days,
not accurate.
health
So-
care, or free testing for hospitality workers. And until they put forth measures that include all of our demands, they are not doing everything they can to protect the health of workers and the public. It's absolutely necessary.
All right.
And we demand that it be done immediately, not 3 months from now, not once it's already circulating in our restaurants and in our hotels and in our bars. It needs to happen
Okay.
now.
Hey guys,
and
we have a
the city
2:30 press
council has been
conference.
aware of our demands
We have
for
a
paid
2:30
sick
press
days
conference
for
in
over
relation to
3
an
years.
update on the pending issues around coronavirus. What
Yes,
I would
we're
request
updating
in
y'all on the
relation to that
needs.
stuff Is that we have the potential for the mayor and our health officials to be able to update the public. This is preventing us from being able to engage with the public about some really important, very pressing issues. That's not mean that this is not pressing. We would love,
This is
though,
part of
to
the
be able to
pressing
have
issue.
further conversation with you in another room while we're having this
We will have
conversation about the press
conversations in the
piece,
public
please.
so they can come and make their
All I'm saying right now is
announcements
we
and
have
we'll
a
be
public health piece that we
Okay,
really
so
need to discuss right now.
We'll wait here for her to
And being
address
able to
our
hijack that piece in order to discuss these other things is really problematic.
So we'll stay here.
And we'll hear about what y'all are going to do, and we'll present what needs to be done.
Now, we will, and I will determine what happens in this press conference.
You get sick.
How you
We
doing?
work sick. You get sick. We work sick. You get sick. We work sick. You get sick.
And thank you so
We
much.
demand paid sick days. We demand paid sick days.
Thank you so
We
much.
demand paid sick days.
Thank you so
We
much.
demand paid sick days immediately.
Thank you so much.
Immediately.
Thank you so much.
We've seen no measures by the
Thank
city
you
to take
so
this
much.
serious.
Thank
No
you so
measures.
much.
I'm not.
Thank you so much. If you would like for me to respond, if you would like for me to respond respectfully, you have to give respect as well. That's what we do. Okay. Okay. If this cannot happen respectfully, then it will not happen at all. If we cannot communicate effectively, which communication is a two-way street.
Meeting with our bosses doesn't equal meeting with
Okay,
the workers. You prioritize
again,
meeting with them, but not us.
You cannot have a conversation when we're talking over one another.
We must,
Wait a minute.
because you don't give us a platform.
You're not being respectful. And I provided, you're not being respectful. If we cannot, well, then we cannot have a decent
I would
conversation.
love to hear what y'all plan to do about this situation, because if it doesn't include our demands, it's not enough. So let's hear, let's see if it includes
Okay,
what we're saying.
again, we must have a respectful conversation, which is two-way.
I serve you food.
So I
I
will,
don't remember, but I serve you food.
okay, being disrespectful is not, it doesn't work.
You're right, it doesn't.
That's right.
What you got to say.
So thank you so much. If there cannot be a positive exchange, thank you. Well, thank you so much. As it relates to the workers throughout the city of New Orleans, in terms of those who are not paid for by, meaning an employee of city government, then that is a private matter, and I do support your position 100% for our people to have access to sick leave and also be provided quality health care. That is our position. It will remain our position, and it's something that we stand by and do every single day for employees of the city of New Orleans. And what's the other?
Baton Rouge, we need to appeal to
What's
Baton
the other?
Rouge in order to
What's the
raise
other
minimum
issue?
wage and in order to get sick leave.
What's the other issue?
We need paid sick days for every worker in this city. We need health care, free health care, and testing to deal with this emergency situation. And moving forward, we already have things like the flu and the common cold that we have to go into work while sick on a daily basis. Workers all around this city, and not one person in this building has done anything about it. 3 years ago, we presented paid sick days to 3 members of the city council, and that was not picked up. We know that y'all are not going to prioritize our needs, and that's why we are forcing y'all to hear our demands and hear our concerns. Paid sick days needs to be a city-wide thing that's passed. It can't just be for government employees, and it can't be up to our bosses to provide it because they're not providing it, and they will not provide it until we make a demand for them too. I serve you sick all the time. You come into my work. So just keep that in mind whenever something.
You
like
serve
this
me
looks-
sick?
Yes, I do. You
Oh.
don't remember. 'Cause
Oh,
us
what was I
hospitality
suffering
workers
from?
are invisible.
What was I
to
sick
you.
from?
We're
The
sick
flu.
serving you.
I was
We're
Yes.
sick
When?
serving you.
You come in every week.
sick with the
I'm not
flu.
gonna tell you where I work.
Okay. Well, thank you so much. I appreciate, one, your advocacy, and one, I absolutely stand in solidarity relative to all city, not only employees, all people, because at the end of the day, that's what it means. Yeah, absolutely.
We're in solidarity with
So
that.
thank you so much. And like I've mentioned prior to this, we are in full support of paid sick leave, quality care for all residents of the city of New Orleans. So thank you so much.
She's saying, take it
She
up with
said
Baton
she
Rouge.
won't do anything to make sure that this is
Minimum
done.
wage.
Well, I'll do what I can do within my authority. Well, that's it. So thank you so much.
Right.
Well, thank you so much. Is that the only issue?
Well, you meet with us?
Is that your only issue?
When are you going to be bringing about the fully funded relocation of the residents of Gordon Plaza, which you promised, I believe, in September, and you promised in your campaign last year? So is that going to happen, or do we have to bring that up with Baton Rouge as well?
Well, first of all, as it relates to Gordon Plaza, the promise was to, one, look at ways that the city of New Orleans could take that matter up with relocation in spite of what the judicial system has said. That is something that is absolutely ongoing. And should we get to the position where we could do that, my support will not waver in that regard. So I appreciate your continued focus on our people in Gordon Plaza. It's something that we're doing ourselves as well, meaning boots on the ground in the community and directly speaking with. No, and that's not the case. But however,
That is the case.
I appreciate, one, your continued advocacy. And thank you so much. Thank you so much.
Support requires action.
It does. So with this, I've addressed these concerns. You all need to leave so I can therefore brief the public on coronavirus.
We demand
Thank you.
6 days now.
Thank you.
6 days, you're out.
Thank you.
We'll be back.
Thank you. You're welcome back. You're welcome back anytime. Come back.
Be back.
Thank
We'll
you.
be back.
Thank you.
We'll
It's a
be
public
back.
health emergency.
Thank
And
you.
that we represent the interests of 100,000.
And I appreciate you.
Be back.
I really do.
Be back.
Thank you so much. Yes. Thank you.
You get sick. We work sick.
Thank you so much. And as a product of the hospitality industry in the city of New Orleans, I can absolutely understand where they're coming from, and the needs of our residents and all of our employees in the city of New Orleans should be a priority, and it is absolutely for me as mayor, and that throughout the city, with the understanding that in my authority, it really is as it relates to the city of New Orleans, meaning the municipality, in terms of what we can do and what we cannot do. We have made sure that our employees with the city of New Orleans do have sick leave, sick days, and access to quality, affordable care. and we will make sure that that continues to occur, in addition to raising the minimum wage for our city employees, in which we have done. So with that, that is under our authority, and we will continue to work with not only activists, but state leaders to ensure that we get where our people really want us to go. And that is health care for all, because they do matter. I recognize that in every way. But I appreciate you being here this afternoon relative to what we now know is a presumptive case, positive, for the city of New Orleans relative to the COVID-19. I had a call with our governor right around 12:45 p.m., right at the time where the state was issuing their press release. The city of New Orleans therefore moved very quickly to issue ours as well, after having that conversation with Governor John Bel Edwards. What we also know is that positive or presumptive positive is now being tested by the CDC in Atlanta, and we do anticipate results within the next couple of hours. Once that is made, or once the results have been made, we will absolutely make you aware of the results at that particular time. However, our community, as it relates to our hospital community, is moving forward as if it is officially positive, making sure that they're taking the proper steps of tracing that will be necessary. What we also know is that the individual had no association with travel at all. So this is the only case of the illness in the state of Louisiana at this time. My administration absolutely is leaning forward on this and is prepared for the moment. As we demonstrated on Friday, having a tabletop exercise with multiple scenarios, in which this one it really is aligned. Our public safety team and public health leaders are working collaboratively, as we have been over the past several weeks, and of course, doubling down with the one case of illness that we know of. This includes leaders throughout the state. On the federal level, of course, the state Department of Health with the governor's office. The Louisiana Department of Health is leading the state its efforts in the response to COVID-19. And at this time, we continue to believe that the risk to the public remains low. We do know that we have the St. Patrick's Day coming to the city of New Orleans, in which we have a huge St. Patty's Day parade. At this time, I'm absolutely comfortable with not suspending the parade this weekend. This is a very fluid situation. Things change from moment to moment, and at which time there becomes a situation to where we're receiving a higher risk of our people, then I will make that call. But right now, there is no need to panic. There's just a real need to continue to collaborate, listen, and learn more about the impacts on our people, on our city, on the region. We do know that the individual is a resident of Jefferson Parish, however, is in Orleans Parish right now. I have been in communication with Madam President Cynthia Lee Shang as it relates to this matter as well. We're going to work collaboratively and absolutely fold her into our conversations, our discussions as they move forward. We do know that there is a state convening of healthcare leaders today at 5 p.m. Our director, and she'll speak to you very soon, is prepared to join in that in that meeting. So with that, I'm going to turn it over to Dr. Jennifer Vegno, as you know, is our director of the city's health department. So Dr. Vegno?
Thank you, Mayor. Thank you all for being here. As you know, this has been a fluid situation, and we have been preparing for this. As Mayor Cantrell said earlier today, the Louisiana Department of Health received confirmation of the first presumptive positive case of COVID-19, the novel coronavirus. The New Orleans Health Department was immediately notified of these results, as was the mayor by the governor, and so we've been planning and discussing ever since. To reiterate, it is a Jefferson Parish resident who is hospitalized in Orleans Parish. Presumptive positive is a term that state labs are using when they have a positive case. It is completely within the protocol to then have that case sent to CDC. So this is in line with what other states are doing. The Louisiana Department of Health, again, the lead agency, has already begun investigating who the individual was in close contact with. This is something that we call contact tracing. The New Orleans Health Department will assist them however they need assistance. Again, there is only one known case of COVID-19 in the state at this time. We expect to see additional testing ramping up this week. As you know, tests are being made available through commercial labs, and we do expect those to be online and available to local providers later in the week. I want to be clear, this is not a time to panic. This is something that we have worked for. This is something that we have planned for. We have constant communication with our state health department. We have communicated with everyone throughout the city. We are reaching out to every segment of the community, and we feel prepared as we can be. This is a fluid situation, and we do expect things to change, and we are ready for that and plan for that as well. I'm going to continue to encourage everybody to take common sense precautions to protect yourself and your loved ones and prevent the spread of all respiratory illnesses, including COVID-19. Cover your cough. Wash your hands. Soap and water is preferred. Plain old soap, plain old water. Hand sanitizer if you cannot get to a place that there's soap and water, but all of those wash your hands for longer and more often than you're used to. If you have surfaces where you work or at home, disinfect them frequently with cleaner. If we're asking everyone, if you are sick, if you are elderly, if you have serious medical conditions, stay home. There'll be a parade next year. We want you to protect yourself. So don't put yourself at risk. As Mayor Cantrell said, the risk to the public remains low, but we do want those who might need extra help to take extra precautions. Thank you.
Well, thank you so much. And I'm going to ask Colin Arnold, our Director of Homeland Security, to also give an update from his perspective as well.
Thank you, Mayor. Good afternoon. New Orleans Office of Homeland Security and Emergency Preparedness is monitoring this situation very closely, along with our partners in public safety and public health. And we're providing regular situational reports to all of our relevant stakeholders, including our leadership. We're also working with our administration to ensure public safety agencies and all departments are taking necessary precautions to limit the spread of germs. We've been preparing for the possibility of local cases for months now, and unfortunately that day has come. I think as early as last week when we had our tabletop exercise, we talked about it really wasn't a matter of if, it was a matter of when, and that when is now. I want to assure you that we have a great team of local, regional, state, and federal partners who are coordinating this response. And as I mentioned just last week, we had a large tabletop exercise with over 95 participants at all those levels of government. And we tested response plans in response to an outbreak in New Orleans. Those plans are being put into action, further refined as we speak, especially with regards to public safety, hospitals, transportation, and schools. This is not a time to panic. The Department of Health is investigating who this individual came into contact with most recently, and at this point there are no indications that would lead us to significantly change business as usual. So scheduled special events, as the mayor and Doc pointed out, will go on as planned at this point, and should that change, we will tell you. We're in constant contact with special event organizers, even for events down the road, and that includes up to and including today. The conversations have been very forthcoming and very well received by the event planners and of course by us. And we want to make sure that we're doing everything we can to do what's best for the public. So for the public, it's important that as this situation evolves, that you get information from reliable sources, including the Centers for Disease Control, the Louisiana Department of Health, and here in New Orleans at NOLA Ready. You can find us at ready.nola.gov. You can find us on social media at NOLA Ready, and you can get real-time alerts to your phone by texting COVID NOLA, that's one word, COVID-NOLA, to 888-777. That's COVID NOLA to 888-777. If you're a visitor to our city, you can receive these same alerts temporarily for a week-long period by texting Tour Safe NOLA, one word, Tour Safe NOLA, to that same number, 888-777. We want to use our public information resources to ensure that you are prepared and not panicked, and we want you to have the facts, not fear. Thank you.
Thank you so much. And we have a tremendous track record of positively being able to communicate with the public. That includes our visitors, and we want to keep that going. So to Colin's point, that text 888, well, to 888-777, you do COVID NOLA, or that's if you're a resident, and then let's give it to them again if they're a tourist.
Tour Safe NOLA, one word, Tour Safe NOLA to 888-777.
Thank you so much. And so I wanted to ask Councilmember Nguyen if she would want to say a few words, and of course share in Vietnamese, which is a priority for
Thank
us
you.
all.
Well, thank you, Madam Mayor. First of all, I just want to thank everybody for being here and thank your administration in your efforts of educating our public in reference to the coronavirus and making sure that everybody gets the same alert. So with that, xin quý vị lên nhắc là hôm nay bà thị trưởng Latoya Cantrell muốn nhắc quý vị là lên tiếp tục rửa tay nếu quý vị mà bị bệnh. Bà thị trưởng muốn nhắc quý vị là đừng có lên đi đâu hết. Ở nhà nếu quý vị mà có ho á, thì quý vị che cái ho của quý vị đi. Và thành phố cũng có một cái cách là quý vị có thể biết tin tức về cái coronavirus là nếu quý vị bấm số điện thoại 888 777, quý vị đánh vô Coron Việt là CORIDNOLA, quý vị sẽ được tin tức về những cái gì về coronavirus thành phố nó sẽ bỏ ra. Cảm ơn quý vị.
Thank you so much. And before we wrap up, Colonel, is there anything you wanted to add? Anything I need to restate from me, something I didn't do right?
Thank you, Mayor. I just want to reiterate what you've already heard. This administration has been working on this topic and on this subject for over 3 months. We've spent an enormous amount of time planning, coordinating, not only at the regional level, but the state, and more importantly, the federal level, and the resources required to do our job. This subject and this challenge is not a one-day challenge. The challenge is to ensure that we make the right decisions at the beginning in a sustainable mode so we can carry this out until we get to the satisfactory end. So that's been our challenge from day one, using the resources that we have. How do we do this in the best possible manner to provide the safety and security for our citizens, our visitors, but in this job, one of the important people and group of people that we look out for are our employees who have to carry out the missions, our first responders. So we have to know what the mission is and take care of our people to be able to accomplish it. And we spent a lot of time doing this, and I have every bit of confidence in the organizations who are tasked with the very difficult challenges ahead that we'll be talking in the future, because this is not the end, this is the beginning.
Thank you, Colonel. Thank you for that. And so we'll take some questions if you have any.
Madam Mayor, do we know what hospital the person who may have
That information remains private. Thank you.
Age or gender of the person being treated?
Well, we're keeping that private as well.
What precautions is the hospital taking to ensure that its other patients and its employees there are protected? And also, can you speak to maybe whether there's contact tracing of anyone who the employees come into contact with?
Right, so the hospital is proceeding as if it was positive, determined by CDC, and that does trigger tracing. And Dr. Vegno, you can speak closely to what that looks like, also dealing with any of the care providers that have come into contact with the individual, if they move from floor to floor, things like that is a part of their process. But Doc, you want to speak a little more clear on that?
The Louisiana Department of Health epidemiology team is very skilled at contact tracing. This is not the first disease. They do it all the time under the radar for a number of diseases. So they are, they have their own protocols of how to contact, and they are very, very detailed in terms of trying to get every person, whether it was in the hospital facility or even outside, trying to track down as many people as they can and assess their individual risk. And like I said, we are here to assist them with that.
And if there is an individual or a case where the virus would spread, it would be the state that would have the ability to shut down that hospital and to ask people who have been coming into contact with people who potentially could be affected to go into quarantine.
So the state, yes, the state works hand in hand with the CDC based on their current guidelines, and then they would make that determination.
WWL. There are medical professionals who have patients they would like to test for the coronavirus, but say they can't because they don't meet all of the guidelines, like these people didn't travel from overseas. Does this case change that?
This case doesn't necessarily change that. We are encouraging all healthcare professionals to call the 24/7 Louisiana Department of Health Epidemiology hotline. That is just for providers, and they can walk them through. The state may be able to do more testing, but more realistically, and this is what's happening all over the country, now that commercial labs have the ability to test, that will open up the ability of doctors' offices and hospitals to be able to send their tests to those commercial labs. The turnaround time on those is several days. It's not a few hours, but it's my understanding that the major lab testing companies now do have that ability. And so each doctor's office or hospital, and many of them have already been planning for this, will be able to do the testing with them.
And that's a good thing. Yeah, that's a good thing.
It's no secret emergency rooms operate at saturated levels already. With the first coronavirus now pinging, there might be a surge towards these emergency rooms. Are you guys setting up any additional screening procedures or any place for people to go to be screened? And then second, I want to give you an opportunity to go over some of the steps people can take to make sure that they don't infect their cohorts. Sure. And how important self-isolation is.
Sure. So again, we are asking everyone to, if they feel sick, to contact their healthcare provider. Your primary care physician is always the first person you should be calling. We ask that they call first rather than going to the doctor's office. If they don't have a healthcare provider or they, have trouble getting in touch, there is a state Department of Health hotline for individuals, for the public, that can also give advice. We do ask if that folks if you do not feel significantly sick, please don't go to an emergency department. If you are very ill, or your loved one appears to be very ill and might need to be hospitalized, please call 911 as you would for any time you felt ill. But we do want to minimize the burden that this might have on emergency departments.
Is that state health office number, should that be the first step?
If you don't have a primary care provider and you want to talk about your symptoms with someone, then the public hotline would be a good first step.
And then just the importance of self-isolation and not passing it on to your
Right. Again, if you feel sick for any reason, please stay home. Again, we have been talking for weeks, we have been asking businesses to really take a look at their leave policies and to do everything that's necessary in order to keep their employees safe and healthy, to not affect others at their business, and to make sure that employees know that they will be supported if they stay home. This is a national conversation. It is a great conversation to have around paid sick leave.
Absolutely. Sent one of my employees home early.
What is the standard or threshold for restricting or canceling mass public gatherings?
Well, it's going to depend on, like we said, this is very fluid. And we don't want to excite fear in the public. And that's very important. And once you start down that road, it's very difficult, to pull it back. And as the colonel indicated, when you're talking about even resources, we do not want to hit the panic button and lose sight of the resources and the dollars that are needed to address whatever those issues are. And so with it being fluid, we want to make sure as we move through that we're able to access resources. And so right now, we're doing the right thing. If and when things change based on the amount of cases, positive cases, that sort of thing, then we will make decisions at that time. But right now, based on the information and the facts that I have as mayor, and it's been guided by my public safety leaders, both locally, state, and federal, that we are low in terms of a risk. And so we will have things move forward in terms of special events as they have been planned to date. And when that changes, you all will be the first to know. But it's very fluid. It really is.
WDSU followed by Fox 8.
Do we have the information about how this person may have gotten it?
No, we do not. What we know is that the individual went to an emergency room and had been there for a while and was tested because of, pneumonia, I believe. And it was kind of getting more severe. But at that stage, the healthcare workers decided to move forward with testing. That did happen. And early this morning, it was determined that it was a presumptive positive. And that's what triggered then the next step, which is getting the CDC to fully test and determine officially whether or not that case is positive. That's the one that we know of in the state of Louisiana at this time. And so the hospital is moving forward as if it is official, so that they're taking all of the necessary steps and throughout their process to mitigate any transfer of the virus.
Has the hospital in question been put on lockdown?
No hospital is on lockdown in the city of New Orleans.
Last question, WGNO.
Do we happen to know of any places that the person may have gone to previously before going to the hospital?
We do not know that now. That's a part of that tracing process that takes place. And so those steps are happening right now. You have something you were handed we need to share? Oh, okay. Yeah, don't be alarmed.
The public.
This is that hotline, and Steve kind of alluded to the hotline
For the public.
that we want to share. But as it relates to the tracing the social behavior or where the individual was employed, that sort of thing, that's still very fluid. And that's a part of, again, the contact tracing process that's happening right now. So the Louisiana Department of Health, the hotline for the public is 855-523-2652. That's 855-523-2652. And so that's great information to have, and this really does come into play, especially when our people do not have access to a primary health physician, that they can get answers to the questions that they seek by calling that hotline, and we're encouraging everyone to do so as a first step.
When did this person go to the emergency room? Was this morning, yesterday, the day before?
No, I really can't even confirm that. Exactly when the individual showed up, that's actually a part of the contact tracing that's happening right now. So hopefully we'll have more details as the process unfolds.
Does the city plan to suspend any non-essential travel? And if not, at what point would that be triggered?
Sure. Well, right now, we haven't suspended any travel. I'm expected to go testify in D.C. on Thursday. And we have even a council member that's at a National League of Cities convening right now in D.C. So at this time, we have not suspended any travel. That can be forthcoming, but it will be a part of the discussions that we're having today and that we'll continue to have as the days progress.
In regards to travel, any updates in regards to the cruise ship industry here, the airport, or anything, any updates on any of that?
Well, the basic updates, and I'll have Colin kind of lean in. We've been on having meetings from early this morning, all from, last week, and we had, of course, our cruise ship industry a part of our tabletop as well. But Colin, you want to share any?
Sure. The port actually reached out today. They do have a press release out right now, and I'm sure you can follow up with them on the details. But the highline details are they're operating as normal as far as cruise ship arrival and departure from New Orleans. The cruise ship industry itself is taking on some responsibility of actually doing some temperature testing and some things of passengers before they board vessels. And so we were informed about that on Friday, and that was verified today in the press release and the indications that I got from the port, from their cruise ship division. So right now they are operating as normal, but the cruise ship industry itself is taking some further steps towards the safety of their passengers and the public.
Yeah. All right, so that's all we have. If there are no further questions, we'll be back. We'll keep you, informed as we learn more, and we just appreciate you. Thank you.
Parish, but who is hospitalized in New Orleans. She would not name the hospital or anything about the patient, so we do not know gender or age. All she did say, which is kind of curious, is that this patient was not known to have traveled anywhere. And that was one of the criteria by which they were using to determine who should be tested. So kind of curious that that person did not travel anywhere. That person went to the ER with pneumonia. It got worse. They tested it. A presumptive case, a presumptive positive came back this morning. It is now in the hands of the CDC, and the mayor said that within the next few hours, they would expect to have those test results either confirmed or not. She did say that at this point, the risk to the public remains low, and that is critical. Numerous times, she said this is not the time to panic by any stretch. This was really a matter of time that they expected ultimately that this coronavirus would reach Louisiana and, in fact, the city of New Orleans. So, again, presumptively, it has happened. It is not impacting big plans for the city at this point. The St. Patrick's Day parade she mentioned by name, that is still scheduled to go on as scheduled this weekend. Having said that, she did say it is a fluid situation, so we will stay tuned. Dr. Avegno, the city health director, you saw her address everybody again, beginning with not a time to panic, but use your common sense. Wash your hands longer than you would ordinarily. Cover your cough and disinfect your surfaces regularly. She did say if you are sick or elderly, play it safe, stay home. If you do feel like you've got the symptoms of something, the flu, a cold, what have you, perhaps this, she said the first thing you should do is contact your primary care doctor. And then after that, if for whatever reason you don't have one, you don't have access to one, the mayor did release a hotline. So grab your pen, we'll put this on our website. The Department of Public Health, the State Department of Public Health has a hotline that you can call and run your symptoms by, 855-523-2652. The governor's office is expected to address the public. Hopefully we'll learn a little bit more information in the next 10, 15 minutes. Let's bring Jade Cunningham into the equation. Jade, you were there at the press conference. Tell us what the mood is like there at the city.
Well, yeah, Karen, the main thing they were saying is something that we have been telling our viewers and something that we've also heard from the city all week long, and that is promoting facts, not fear. And that really has been the mood over here today. Of course, just delivering as much information as they can to the public, trying to let them know everything that is going on as much as they can, but again, not inciting panic. They're saying right now is not the time to panic, that people just need to go on with their daily life, but of course practicing safe hygiene, washing hands, covering your mouth when you cough, things like that. But again, Karen, it's about delivering the facts to people and not inciting fear.
With very legitimate concerns, people without health care, without paid sick leave. We did hear a bunch of protesters at the beginning. Give us some perspective. How many were there? Who did they represent? And what were their demands?
Yeah, this press conference was supposed to be starting around 2:30 or so, and when we got here out in the hallway, there were about a dozen or so hospitality workers, all had signs. They were chanting. They came into the press room, actually, where the press conference was expected to be held, and they were saying over and over again that they were demanding sick pay. You know, that the hospitality industry in New Orleans is huge. There are a ton of people who work in restaurants and hotels, and, you know, this message that we keep hearing from officials time and time again is that if you're not feeling well, to stay home, take care of yourself, get better. And so one thing that they really wanted to make clear was that they don't always get the sick pay that other people's have. So they can't always take the time off and stay at home when they're not feeling well. So that is something that they wanted to address today. They, again, were chanting, and they just wanted to have a meeting with the mayor to discuss these things. You can hear them and what the scene was like earlier, again, about a dozen of them, again, demanding that meeting with Mayor LaToya Cantrell and other city officials. They did have a little bit of back and forth with the mayor as she came in. The mayor saying that they do matter and hospitality workers do matter in this city, and that is something that they will be considering and looking at. And then ultimately, after about 10, 15 minutes or so, the hospitality workers left saying that they will be back. And this is a conversation that is not over with and that will be continued at another time.
To that presumptive case, that positive case, what are you hearing about the patient and efforts to contact anybody that person may have been in contact with?
So right now, we don't have a whole lot of information about the patient, just that they are from Jefferson Parish, but they are at an Orleans Parish hospital at this time. It is a presumptive positive case, so they have done testing, initially came back positive, but they need to send those results to the CDC in Atlanta, where testing is being done to ultimately confirm to confirm that positive case. And we are being told that that could come back, those results could come back in the next couple of hours or so. Other than that, we don't have a whole lot of information. It was mentioned, though, that the person did not have any association with travel, which is very interesting, because that is something that is if someone's not feeling well, it's part of the screening process, basically, is if someone's not feeling well and they talk to their healthcare provider, the first question is if they would have traveled overseas or if they were in close contact with someone who was traveling overseas. And in this case, that wasn't the case. So that is about it. That is all we know at this time. Right now, officials, though, are following protocol, and they are trying to trace their contact with other people, and those people will be sorry, my photographer is trying to talk to me at this time. But yes, those people will be, and the officials will be in touch with those people who have been in close contact with this patient. So that is all we know at this time.
And then, we know in San Antonio, in Austin, they have canceled, really, the South by Southwest concert. But here in New Orleans, everything is going on that was previously scheduled at this point, correct?
Yeah, this, of course, is a fluid situation at this time. But right now, they are just talking about the facts. They're not inciting fear. And they say everything will go on as planned. Obviously, this is a big weekend with St. Patrick's Day parades. We have a bunch of festivals coming up. But right now, things are going on as planned. And they are, again, just encouraging people to practice safe hygiene. Like, we can't stress enough. Washing hands, covering your mouth if you cough or sneeze. If you're not feeling well, to stay home, because that is the best thing that someone can do if they are feeling under the weather. But again, festivals are all going on as planned. The parades are going on as planned. But if that changes, they say that we will be the first to know. And of course, when we find that out, we will let our viewers know first thing. But we also do want to mention that hotline one more time, because if people are feeling under the weather, they are encouraged to call 855-523-2652. Again, that's 855-523-2652. They can call that number, they can speak with the healthcare professional, and then it will go on from there as to what the next steps will be.
You asked the mayor a question about, I guess, access to the tests by doctors who believe they're warranted. What was the response? That they do feel that they're going to be able to test those patients they suspect of being sick?
Yes, they did mention that they will be able to do the testing with patients. Again, you know, it was kind of a unique thing to hear that this person did not have any association with travel. And so that was one of the things that we're hearing from health experts, is that they have patients that they would like to test, but can't, supposedly, because they don't meet all the criteria. They haven't gone overseas, or they haven't been in close contact with someone overseas. So that was a question that we really wanted to ask. And they did say, you know, along the lines that, yes, you know, testing will be done, and they are really trying to implement as many tests as they possibly can with these people who aren't, you know, aren't feeling well or displaying symptoms.
Right. Now, let's talk a little bit. There is some disinformation out there. We want to make sure that people are coming to us with their questions so that we can answer them. And you can stay with us if you don't mind. But we want to let our viewers know that at 3:30, we're expecting to hear from the governor's office. And at 4 o'clock, we're going to bring you a special newscast. And we are soliciting your questions. We know that you have them. And again, I feel like we all feel better when we feel prepared and we feel armed with knowledge, right? Facts over fear. We've said it repeatedly. If you have a question about the disease or the condition itself, we're going to have an epidemiologist here fielding your questions, very specific ones. I saw one from a woman who is pregnant and had a very specific question. We will ask that of the epidemiologist who will join us on set. All you have to do is text us your question. So put this phone number into your contacts list, and you can text us at any point. We'll make note of them, and then we'll bring them up as we bring the experts on set with us. So 504-529-4444. Also, the coronavirus not just impacting us, you know, physically and emotionally, but also financially. So the Dow down about 2,000 points today. A lot of people may have some misgivings about that, have some questions about their 401ks. We will also have a financial expert to field that as well. So, Jade, any parting thoughts from you?
Yeah, just to reiterate what the city was saying is that now is not the time to panic, that we are just simply moving on with day-to-day operations. Things are still planned, you know, the St. Patrick's Day parades, other festivals, things like that. Of course, this is a fluid situation, but everything is planned. Again, we just want to say that, you know, right now it is one suspected possible case of the coronavirus. Is a person from Jefferson Parish who is now in an Orleans Parish hospital. That hospital is now taking the proper protocols, and results are being sent to the CDC to verify the positive result of this coronavirus test. This person, we were told, went to the emergency room. They tested for pneumonia. Apparently it got more severe, and that was what prompted the coronavirus test as this time. But yeah, this is all about telling viewers and telling people all about the facts, not inciting fear at this time.
Very much. We appreciate you joining us. And again, we are awaiting the governor's press conference. Should start about 4 minutes from now. In the meantime, we are joined on the phone, I believe, by Dr. David Mushhat from Tulane, a doctor of infectious diseases. Good afternoon, and thank you for joining us.
Good afternoon, Karen.
You've heard the news. There's one presumptive case here in the state of Louisiana involving a Jefferson Parish resident who is being treated at a New Orleans hospital. Your thoughts, and put it in perspective for us.
Yeah, Karen, so it just really comes as no surprise. You know, we knew it was just a matter of time. It's all around us. It's throughout the country. And, you know, we've known that there probably were a few cases in the community, but we weren't able to detect them. And so finally it's happened, and that shows that, you know, in many ways that the system works. The testing and the triage is working. It's very likely that this will be confirmed by the Center for Disease Control with their test. But there's really no reason to panic. I mean, you know, remember, influenza or the flu kills 20, 30, 40,000 Americans a year and infects tens of millions. And at this point, you know, this virus is not nearly at that level of intensity in terms of how widespread the flu is. And so we need to put it in perspective. But bottom line is, there's no surprise. We knew this was coming, and so now we simply need to move forward.
Were you surprised at all, doctor, that this patient had no known travel history?
A little bit, but, on the other hand, I suspect that with the recent Mardi Gras festivities, with people coming from all around the country and frankly from all around the world, we all kind of thought that there would be something would start happening around now, with the incubation period. And then, of course, people get sick for a while before they even come to medical attention. And so the timing is actually about right.
And let me ask you this, and forgive my ignorance if I'm wrong, but I was explaining to my daughter that the coronavirus is really an umbrella term, right, under which even the common cold would fall. This is a new strain, but it could present like a cold in somebody who is pretty healthy and young, correct?
Absolutely. And the good news is that, the latest data I just looked at shows that about 85 or 87% of people who get infected with this particular coronavirus actually have very mild illness. It would be like a cold or a mild flu. So it's only a relatively small minority of people that get sick enough to go to the hospital or to go to the intensive care unit. So yeah, it may very well present like the common cold or a case of the flu.
Now we do know though that the elderly are more susceptible, right, and those with maybe compromised immune systems. What if you are caring for somebody like that? Do you need to keep your distance, or you're scheduled to visit that person? Should you not?
Well, I think if you are, if you were planning to visit, you may want to think twice about that.
Okay.
Certainly, it's not unreasonable for somebody in the household to care for somebody with this, but obviously you need to use common sense precautions like washing your hands with soap and water regularly, or using alcohol-based hand sanitizer. Not sharing utensils, glasses, dishes, toothbrushes, razors, things like that. And of course, everybody should be coughing into their sleeve or into a tissue. So fairly common sense kind of stuff will go a long way.
Doctor, we have been soliciting questions from our viewers, very specific ones, and you can see on the bottom right of your screen, if you're at home and you want to send us a question, just text us your question at 504-529-4444. We have a woman here, a pregnant woman, who says, what are the risks to pregnant women, especially pregnant women who work in hospitals? Do we know how COVID-19 affects a fetus?
Great question, and I saw some discussion about that yesterday. We do not know. And probably because very few pregnant women, as far as we know, have become infected. So this is something that we need to learn about as we go forward. Experts will be looking at these issues. But remember that pregnant women, in general, have slightly weaker immune systems, and this is true when it comes to influenza and other viruses. So they do need to be careful and take common sense steps to protect themselves.
Another viewer is asking, how do I know if I'm infected? I have a blocked nose and sometimes I breathe hard. I mean, we know that a shortness of breath but you certainly don't need all of these people either flooding the hotline or, in the worst case scenario, an emergency room.
Correct. So generally speaking, if you have this virus, you're going to have a fever plus either cough or shortness of breath. But don't panic, because, if you have a low-grade fever and a cough, it's probably more likely that you have another virus or the flu. And if you're not super sick, you're going to be all right.
Right.
You don't even necessarily need to go to the hospital. But if you get sicker to the point you start becoming short of breath, or you can't keep liquids and food down, then you do need to call your doctor's office or go to the hospital. So the bottom line is, for people that have very mild symptoms, if there's any question, call your doctor or your doctor's clinic, and they can help you triage the situation.
Doctor, would you travel domestically or internationally right now?
I would personally probably lie low right now. I think this is not the time for us to be doing a lot of traveling and going to big festivals and things. I mean, not everybody would necessarily agree with that, but I think that if, as a country, if we come together in this and we all do our share in terms of trying to avoid spreading this, we can help curtail this epidemic. So I would be cautious.
I was reading this morning that the summer months may help, I guess, like it does when you see the flu traditionally dip in the summer. Does that mean with our warm climate, we may not be as susceptible as somewhere, colder?
I've wondered that myself, and believe it or not, to this day, we don't really know why certain viruses, such as influenza, wane in the late spring and early summer. One theory is that the viruses are temperature sensitive. The other possibility is that during the winter months, we're more likely to be indoors in crowded conditions. Certainly in Louisiana, that's less the case because we have a milder climate, so we're outside year-round. So it may not be that simple. But I think there is something to the fact that the more you get outside, the more the environment works to your advantage. You have the breeze, fresh air, and we know from way back in the days of tuberculosis when we didn't have treatments, that fresh air was a way to keep people from getting infected. So you're probably better off outside than inside.
So appreciate having you join us because there are so many questions. Even I had two. What are the criteria for testing? So what does a person have to present with in order for them to be tested?
So this is an area of confusion because the Centers for Disease Control now says a healthcare provider can consider offering the testing to anybody who they deem to be possibly infected. And so that could be just based on fever or cough. The problem is that the commercial tests that would allow for this to be done are not readily available yet. And we really prefer that providers go through the state Office of Public Health because they have the test in Baton Rouge. And certainly, I think, I don't recommend routine screening of people that are able to stay at home who are not terribly sick. But if they're sick enough to come to the hospital, especially to the emergency room, if they have that fever and cough and/or shortness of breath, and they have any risk factors, i.e., they've traveled to a high-risk country or they've been exposed to a known case, then we're certainly going to do that. Everybody else, it's a little bit of a gray area, and that's something that the CDC and the state and other experts are working through at this time. So
tell us what's happening behind the scenes now. Now that we have this presumptive positive, the doctors, the nurses, everybody who treated this person, the person who brings the food in the hospital, are they all being monitored? Are they being self-quarantined? How does that work? Well, so, many of the healthcare workers have taken precautions so that they do not have to undergo any kind of screening or quarantine, but there may have been a few people that might have been exposed initially before it was known that this person might have this, and so those people would be certainly at the very least under what's called self-quarantine, where they are to report if they have any fever or develop any illness. But the bottom line is, healthcare workers are, I think at this point are well trained to know what the symptoms are, to know how to get tested, and how to take precautions to protect themselves, which is important because then that helps protect the spread within hospitals. So we're expecting the governor to start his press conference any moment now. With these last few minutes, what do you want to leave the viewers with? Again, facts over fear, and we just want people to be able to put this all into perspective, and yet at the same time, not ignore something that might need to be seen. Right. So I think the first thing is take a deep breath. Don't panic. I mean, every year, many, many more people die from the flu or end up getting hospitalized because of the flu than will get sick and be in the hospital with this particular virus. That being said, be careful. Listen to the information that's coming out. There's lots of good websites such as the WHO, the CDC, and others. Stay abreast of the information. Common sense things right now are to be pursued, such as washing your hands and frequently and not touching your nose, eyes, or mouth. Basically stuff that we can all do. Stay attuned, but don't panic. It's not the end of the world. We will get through this, and there are really smart people that are working on these issues, and I'm confident that we will get through this crisis together. Well, Dr. David Mushat, you have been fabulous. I hope that you will stay in close contact with us so that we can continue to kind of just bounce these questions off of you. There's just so much information that we don't have about this, and it certainly helps. We're hearing, just before we leave, we're hearing that perhaps China hasn't seen any new cases, at least they claim, in a little while. Do we think that it's peaked there? And if so, can we glean anything from that? Is it a short-lived burst of cases, for lack of a better phrase, pardon me, but you get what I'm saying. Right. So I mean, best case scenario is that the virus does peter out in April or May, just as other respiratory viruses tend to do, like the flu in the winter. China has very few daily cases now, so it does suggest that containment and quarantine efforts may have made a difference. On the other hand, one could quibble with the sort of authoritarian nature
of some of the policies, and it's something that we can't take those measures, certainly in a democracy. But certainly,
Doctor, I'm so sorry to interrupt you. We do hope you'll stay close by with us, but we want to take our viewers now to Baton Rouge, where we've got Governor John Bel Edwards updating us.
Joining me and State Health Officer Dr. Jimmy Guidry and Assistant Secretary for the Office of Public Health, Dr. Alex Biu, and Interim Health Secretary Stephen Russo. Today, the Louisiana Department of Health confirmed the first presumptive positive case of COVID-19, commonly called coronavirus, in the state of Louisiana. The patient is a resident of Jefferson Parish and is currently hospitalized in Orleans Parish. In order to protect the patient's privacy, we will not be releasing additional details about that case. We've done 15 tests total. 14 of those have come back negative, this obviously being the only one that came back positive. The next step, and when it's underway, is for the presumptive positive test to be sent to the CDC for confirmation. This confirmation may take up to a few days to occur, but we are confident in the result of our test, so we're treating this situation as we would a confirmed positive result. Keeping the individual in isolation, interviewing those who came in close contact with them to assess their risk and assessing what other precautions should be taken in the local area to reduce the spread of illness. We've been preparing for this moment for many weeks because we felt certain this day would come based on the information that we've been getting from the CDC and from our partners in Washington, D.C. I'd like to briefly speak about the coronavirus testing because I know that there has been some concern about who should be tested. Currently, Louisiana has several testing kits from the CDC in our state lab with which we can do several hundred tests as needed. We are confident the CDC will give us additional testing kits as needed as we move forward. This morning, I was on a conference call with Vice President Mike Pence and other health and state leaders, and we were told that commercial testing will go live across the country and in Louisiana this week. This is important because testing capacity is a concern for all states. Commercial testing means that more people who are sick will be able to talk to their health care providers about their risk and if they need to be tested, and certainly that is a good thing. Our role at the state will be to take any test that is presumed positive by a commercial lab to verify it at the state public health lab before sending it to the CDC for confirmation. The verification will be important as these commercial tests come online. We have the capability to test hundreds of people, and it will only increase with the CDC providing more tests and with more commercial testing coming online. That said, you will begin to see the testing number go up for two natural reasons. First, we will conduct an epidemiological investigation of this presumptive positive case to determine the risk to the patient's family, friends, and those that they may have come in contact with. Some of these people may be tested based on their risk factors. Second, the state of Louisiana recently expanded its testing protocols to include a broader group of people. This means that if you have traveled to a country or region of concern or come in close contact with someone who has COVID-19 and are showing signs or symptoms of illness, and you have a negative flu test, you can be tested for COVID-19 here in Louisiana. At all times, our testing protocols have mirrored those of the CDC, and at no time have we not tested anyone who met those guidelines. To put this in context, the CDC reports at least 35 states, including D.C., have cases of coronavirus. Understand that the case in Louisiana has not been officially included in the CDC reporting as of yet because it has yet to be confirmed by the CDC. Close to 600 cases have been confirmed across the United States of America. Right now, the risk is still low for spread here in Louisiana and in the United States. We are obviously taking this seriously, and we've been preparing for this for many weeks. Last week, I held a unified command group meeting and created a COVID-19 task force to lead the planning for different scenarios as COVID-19 was spreading across the country and would almost certainly come to Louisiana. Our agencies are communicating with federal officials and with each other to ensure that we're doing everything we can to prevent the spread of illness. And certainly we need the people of Louisiana to be vigilant as well. The public is encouraged to wash your hands frequently and well, to make sure that you control your cough into your elbow, to disinfect frequently, use surfaces, and to avoid close contact with people who are ill. And if you are sick, please avoid going out in public, stay home from work or school. This will help us tremendously to prevent the spread of illness. The most important thing the people of Louisiana can do today is listen to the advice of public health officials. One thing that the Vice President and federal officials asked us to stress is that our senior citizens and those with chronic health conditions need to take extra precautions to protect themselves and be certain to avoid contact with people who are sick. And these precautions naturally extend to every person who lives in households with these individuals who are especially vulnerable, meaning in households with senior citizens and those who have these underlying health conditions. So I want to reiterate, we've been preparing this for several weeks. Now is the time to rely upon the best available information as it is made available to you, to take every precaution that has been suggested to you, and to take this seriously. So with that, I'm going to pause and take your questions, many of which I'm sure will be answered by the subject matter experts who are up here with me today. Yes, ma'am. Well, that specific event is not on our radar, although we are watching what's happening in other states. We don't currently have a CDC recommendation that relates to canceling events. We are in consultation with local officials and organizers of these activities and these events, and these are some of the things that we're going to be deciding over the next several days and potentially over the next few weeks as this situation further develops. Yes, ma'am.
The age of the victim and any idea about contacts you might have had in Jefferson Parish?
Okay. I'm going to go back to what I said. I've announced all the details about this case that I'm going to announce.
Are you able to tell us how many people may have been in contact with this individual?
What I can tell you is we are actively doing that epidemiological investigation to determine that information. And then with that information, we will then be making sure that any individual who needs attention or screening or testing, that becomes available to them.
In some schools, or in some states, schools have been impacted. Is that something that you foresee being a possibility?
Well, certainly anything right now is a possibility. I don't want to sit up here and sort of guess at what may happen. We are working every day with our federal partners at the CDC, but also with other states, some of whom have already had a case or multiple cases of this novel coronavirus, and we're trying to see what they've done that works and what potentially doesn't work. And as we have more information related to potential impact of schools, we'll let you know. I will tell you this, if you go to coronavirus.gov, there's a series of recommendations all built around mitigation of the coronavirus, and you can access recommendations for households, for businesses, for schools, and other entities, and I'm encouraging everyone to go out and do that.
In some states, some lawmakers have voiced concern about the economic impact that this could bring to the state. What are your thoughts on that?
Well, obviously it's far too early to speak with any specificity on that. There will be an impact. It will be adverse. That much we know. We don't know right now exactly what that's going to look like. I will tell you it's more important than ever that we take the time to look at the modeling that is given to us by economists who are experts, and then make our decisions based upon their very best guidance for us. And that's really the process that we have in place through the Revenue Estimating Conference, and that's what's going to play out. It'll meet in, I'm not exactly sure when, but in a few weeks. We have some time before we have to have a revenue estimate to inform our budget process, because it'll be sometime before that budget bill starts to move. And we're going to do everything we can to strike the right balance between getting that information as soon as possible, but also getting the most accurate information so that we can base our budget on it. Yes, sir.
Governor, you said the state has tested 15 people as of today. Do you know how many have requested tests?
I don't know how many have requested tests. I know we've tested everyone who met the testing protocol that mirrored the CDC recommendations, which is what we were doing in Louisiana. I'm not aware of a single instance where we have refused a test. Looking over at Dr. Bayou.
That met guidelines.
Yeah. Yes, sir. Yeah.
Without compromising patient privacy, can you say whether he or she had traveled abroad recently or was traveling out of state?
You know, this test result came positive, I think, at noon today. And the investigation is ongoing. And there's some things that I'm not going to share with you because of trying to protect the patient's privacy. Other things I'm not going to share because I would be guessing, and I'm just not going to do it. And so as we have more information that is appropriate to share, we will do that. Yes, sir.
Yeah, going back to what you said about the REC. So internally, are y'all thinking about making any changes to your budget proposal, either because of potential economic impacts from this or from what we're seeing in the oil markets?
Yeah. Well, we're not, you know, the oil market turned over the weekend, right, and today. And so we're not further along than you probably think we are on that. But obviously we will be talking to economists, including the economist who works at the Legislative Fiscal Office and the economist who works at the division. And those are the two opinions that inform the REC about the forecast that ultimately gets adopted. And then once we have a better picture, we will then have a series of recommendations that we will work with the legislature, and I suspect this will be a topic of frequent conversation between myself and the Speaker and the President over the coming weeks. It is just too soon right now to really speculate as to what this impact is going to be. I mean, we know it's not going to be positive, but we don't know exactly what it's going to look like, and so I just don't want to engage in that kind of speculation right now. But it is a good thing that we have the REC process that we have, because we rely on economists to tell us what we can expect, and then we budget based upon those expectations. Yes, ma'am.
When you say it's here, immediately people start to think, okay, it's here, you know, panic. How do you stop the panic from people in Jefferson Parish who are thinking now, oh my gosh, somehow our community may have had it?
Yeah. Well, first of all, it would be my hope that we try not to even use the word, but it's counterproductive. It doesn't help. What people need to do is take stock of the situation, take it seriously, but understand that these precautions are very, very effective at limiting the spread of this virus. And they're the same precautions that ought to be second nature to everybody anyway, because they help us with respect to the flu, which in any given year, 2 years ago, it was 61,000 people who died of the flu. This year, 48,000 or something like that who died from the flu. And that is not to minimize what the situation here is with coronavirus, but just to let people know that we don't panic every time there's a flu outbreak. We take it seriously. When there is a vaccination, you should get it. And until that happens, you wash your hands. You avoid contact with certain people unnecessarily, the handshakes and so forth. Cough into your elbow and don't go to work when you're sick. That's what we need to be doing. And individuals, and once we do this investigation, because I know your question was specifically about this individual from Jefferson Parish, once we do this investigation, we're gonna know who we need to go talk to. And then they're going to have every opportunity to be evaluated and so forth. So it is just, you mentioned the word panic. That is never the right thing to do. And that's certainly in the case right now, I know. Yes, ma'am.
In terms of the conversation with the Vice President, did he give any sort of broad outlines of travel and what he thought was sort of the best guidance and what was most appropriate for people, whether that's avoid cruise ships or try to avoid plane flights?
Yeah, well, not from the Vice President himself. He did have people available on the call, Dr. Tony Fauci, for example, who specifically talked about travel. And in consultation with our public health experts here in Louisiana, I will echo what we were told, which is no different than what they started saying over the weekend. Older people, and those individuals with these chronic health conditions, with compromised health, they should only take a flight if absolutely necessary and should not under any circumstances go on a cruise right now. And so that's what's coming from Dr. Fauci, and that's what's coming from Washington, and that's what we're going to echo here. As it relates to travel more broadly, the Centers for Disease Control, working with the Secretary of State, the Department of State, they're continuously upgrading which countries are Tier 1, Tier 2, Tier 3 countries. And then as that list changes, then obviously where people should and shouldn't travel will change, and then what the protocols related to testing individuals who may come to our country from those countries will also change. But I would encourage everybody to pay attention to what the Department of State and the CDC is saying about these countries, because I don't know that anybody, first of all, you don't want to go and unnecessarily expose yourself to this virus. Secondly, if you don't have the virus, you don't want to come back and spend 14 days in isolation. I'm not going to say anything more about this particular case that we announced today. Yes, sir.
I understand a couple of nursing homes on their own have told patients they need to stay inside and restricted access from visitors. Yeah. Is this a directive from the state, and if not, is it an appropriate directive?
Well, it's a directive that the nursing homes are taking on their own at this point, but it's based upon information that they are getting probably from the State Nursing Home Association and from the National Association. And these are healthcare providers. In light of the fact that we know it is the elderly population most at risk from coronavirus, the novel coronavirus, COVID-19, and those with underlying serious health conditions, those are the people who populate nursing homes. Then you can expect that they will have more precautions in place, and that those may evolve over time. And I'm not going to second guess them here. I will tell you that later this afternoon, we're going to have representatives of all of the major healthcare stakeholders here to have conversations with them. So it'll be hospitals, nursing homes, those sorts of folks, and we may learn more about precautions that they're putting into place now. Sam?
Governor, can you talk more about exactly what happens with this patient and the people they've come into contact with? The people, their family and friends that they've interacted with, going to be put in quarantine? How long, where, how does that work?
Okay, I'm going to ask Dr. BU or Dr. Guidry to come up. I know the words epidemiological investigation. I think I know what that means, but I probably am not the best person to answer the question.
Yeah, so actually exactly as the governor said, what the team is doing right now is trying to find out who those individuals are that need to take other precautions. Anybody who's been in contact with that case would be treated like somebody who's been to a country that has spread of COVID-19, and that means those recommendations we've been making now for a while, stay home, monitor for symptoms, that would now apply to them. And we'll be communicating all that to those individuals, as the governor said, who need to know that information.
And that would still be a voluntary self-isolation type thing where you guys ask them to
That's right.
isolate for 14 days?
So far, we've had nobody disagree with that.
Yes, sir.
It'll be 14 days, right? That's the
Yeah, currently it's 14 days. That's the guidance that we're continuing to follow, that other jurisdictions are using across the country.
It is something that the task force is evaluating. The task force meets tomorrow, and following that meeting, I will have the benefit of a new series of recommendations that will come forth. And they will be looking at things like travel, for example, by state employees. They're going to be looking at things like events and so forth. And even if it's not advisable now to curtail some of those activities, we probably ought to go ahead and determine what factors we're going to look at in order to know when it does become advisable, so that we're making the best decision that we can make on a timely basis and getting out in front of all these things. But those are things that I expect to hear from the task force tomorrow, among other things. Yes, sir.
How many people in Louisiana have been asked to self-isolate after traveling to a level 3 country or another place affected by the
Yeah, I'm going to ask Alex.
So I don't have that number off the top of my head, but we can certainly get that for you.
I know that as of about a week ago, it was about 3 dozen or so individuals. And then you have some groups that have traveled, whether they're church groups or school groups, and they've decided to do some things on their own, but that aren't necessarily being recommended by us. And so we don't have one single answer to give you on that particular question. Look. That we are, I'm sorry, ask your question again. I didn't understand it.
So there's hundreds of test kits or
yes.
ways to test. What's the specific number that you have?
Well, we were given 1,000 test kits initially, and then this past week we got 2 test kits of 500 each. And so that's 2,000 test kits. Now, that doesn't mean we can test 2,000 people. Because it takes 3 to 4 kits per person. And then once you test for an individual or other individuals, the kits related to that particular plate are no longer usable. Did I get that somewhat right?
Yeah, essentially, it depends on how many samples we run at a time, how far we can go. But as the governor said, hundreds.
And that's why the easiest way to communicate that is we're telling people how many individuals can be tested right now, and that's why that's the number that I gave you earlier. No, well, I don't believe we will. We have several hundred that we can test now, and then the commercial testing is coming online this week. And so we don't believe, and by the way, as the commercial testing comes online, you're going to see expanded protocols as well. And so you're going to see more people who ultimately are tested. Yes, sir.
Do you know which commercial labs in Louisiana are opening, exactly where they are, and whether they are being provided more kits by the federal government?
No, they are. Yeah, and that's one of the things that the Vice President and the folks are on the phone today, and I don't remember who it was that gave us our testing. Oh, it was Dr. Burks, Dr. Deborah Burks. She gave us an update today about the testing that will become available through these commercial entities starting this week. And because what they're looking at is being able to do a lot of high volume throughput. And as you can imagine, when you look at the states around the country that have had the most cases, that's where they're going to focus first. So but they are getting these test kits out all over the country. And so this commercial testing is going to be much more available. And it will work, I think, for the patient. It will look just like any time that they go and the doctor orders blood to be drawn to be tested for whatever, in whatever condition. That's the way this is going to work going forward.
Do you know which specific labs in Louisiana might do this?
Well, do you have that information?
Yeah, so LabCorp should be able to do this testing, and we're told by Quest in the next 2 weeks they should also be able to do this testing.
Yes, ma'am.
Are there any measures being taken at the airports in New Orleans, large travel airports?
Yeah. Well, those measures were actually taken several weeks ago. And so as individuals travel into the country from these countries of interest, they are being routed into certain airports, and then they are being screened. If from there is a passenger who should be of interest to us, that gets communicated to Louisiana from the federal government, and then we pay attention to those individuals who are here. But that's actually been taking place for some time. Yes, sir.
As community spread is increasing within the United States, though, is there going to be an effort to increase testing at airports for domestic travel?
I'm not aware of any additional testing at airports for domestic travel. The testing protocols are, as I've mentioned them, every time the CDC revises their guidelines, we revise what we do.
We've got one case, but generally after that you hear about more. How will you continue to get the information out? Are you going to do a press conference every day? Is it going to be something that's...
Well, what I can tell you is for every presumptive positive test, you will hear directly from the state, either myself or the Department of Public Health at Louisiana Department of Health. I don't know that we're going to do a press conference every single time. I can imagine, however, that periodically we are going to have a need to do a press conference so that we can share new information and give you all an opportunity to ask questions, and we will figure that part of it out as we go. But we're going to be issuing statements, and again, if you look at social media, it's full of a lot of folks out there saying things that are just not true, and that's why I've made it a very big point with us. We're going to be very transparent, we're going to be very timely, and we're going to be factual, and we're going to tell people when we have a positive case in Louisiana. Yes, ma'am.
As more cases or more people are being tested, you guys expect more cases here?
Yeah, well, that seems to be what's happening around the country and other states. Once they get their first one, they typically get another one and so forth. And we don't have any reason to believe that that's not going to be the case here in Louisiana. But that's why it's important that people take the precautions that we're giving them, because we can limit this. But it's going to require everybody doing their part. And so, yeah, it looks as though this is going to continue to get worse for some period of time before it gets better. But how much worse is really dependent upon how many people do the things we're asking them to do. And for those people in the media, that's where you can be especially helpful. Spend as much time talking about the precautions as you do about other things related to the story.
On the subject of precautions, have you started conversations with the House and Senate about what happens if this, in the legislative session, if there is a need to start isolating any legislators, or kind of what happens on how to take precautions? Because, and I ask that because we just got where the Florida House just evacuated because several members of the Florida House had been to the CPAC conference, where people were confirmed to have the COVID-19, and so now people are self-isolating who are legislators.
Yeah, and so we haven't had those conversations yet, but these types of conversations and plans are what we've been talking about with the continuity of operations. Which is a big part of what our task force is doing, and we've had continuity of operations plans going back to SARS and MERS and H1N1, and they just have to be updated. And now we need other private sector entities need to do this. What do you do if you have individuals who cannot come to work and so forth? And so we certainly would encourage the House and the Senate to look at this, and as it relates perhaps even to other things that involve their operations. Yeah. Yeah, well, as I mentioned, one of the things that, and this is very difficult for me, and I want to tell you because my instinct has been developed over the 53 years I've been alive, and that is to walk up to someone and shake their hand and talk to them. And I have to continually remind myself, and sometimes I am forgetful. But we're asking people to minimize direct personal contact, not just with people you don't know, but it doesn't matter who it is really, in order to minimize the spread, the community spread of this particular virus. And so while it's difficult for me, and I suspect for a lot of people out there, it would be much better if we didn't engage in those typical expressions of friendship and so forth. And you saw that this weekend playing out at churches across the state of Louisiana as they revised their guidelines about what they're doing as well.
I know you've answered so many questions.
Yeah.
Is the Department of Health or anyone able to tell us how hospitals in New Orleans or Jefferson Parish currently are doing anything differently?
Well, I'll ask them to come up and give it a shot.
Sure. Well, as the governor noted, the work of the task force and of the department has been to put out guidelines, not just for hospitals, but for long-term care facilities, businesses, schools. And after that, we're following up with these organizations to make sure that they have continuity of operation plans. I don't know about every specific hospital in New Orleans at this moment, but as the governor also noted, heads of those healthcare institutions are going to be convened at his request this evening to discuss.
Okay. Look, I want to thank y'all for coming out. Obviously, this is a developing story here in Louisiana, around the country, and around the world. It's something we need to take seriously, but timely dissemination of factual information and having individuals take the precautions that have been put out by the CDC and echoed here in the state of Louisiana that's the most important thing that we can do at this time. As we have more information, we will be quick to share it with you. That is a commitment that I'm making with you in this room and to the people of Louisiana today. So thank you so much.
From Channel 4's Eyewitness News, this is breaking news.
And we want to welcome you to a special 4 o'clock edition of the Eyewitness News. You just heard from Governor John Bel Edwards updating the public on the first presumptive case of the new coronavirus here in the state of Louisiana. All we know about this person is that it is a Jefferson Parish resident who is currently hospitalized in New Orleans. And Sharice Gibson joining me now. Just back, you just got off a plane yourself.
Not even about 2 or 3 hours ago, just getting off a plane and going through the airport. Really interesting because obviously we've talked about the mask and how it would only help to protect if you are sick and stop from the spread of the virus. But seeing a lot of people in the airports with the mask, and not as many here because there were no, at the time, confirmed cases. But now obviously that we're seeing that this happened. And in this update, I think that there were people that will take more precautions. I noticed on the plane, a lot of people were wiping down, which is usually, some people do already, but they were wiping down seats, using Clorox wipes. And you saw an ample amount of hand sanitizer everywhere. Everyone taking more time in the bathroom to wash their hands. And some people didn't even want to go to the airplane's bathroom. They wanted to make sure that they got off so that they can get somewhere that was a bit more sanitary. So there's a lot of precautions that are being taken right now.
And a lot of questions too. We want to put everything into the proper context. So we are soliciting your questions. All you have to do is text them to us at that number on your screen, 504-529-4444. And you can just text us your questions. We're going to be fielding those health questions, also financial questions. We know the Dow dropped like 2,000 points today, impacted not only by the coronavirus, but by the price of oil just collapsing. So Ed, let's talk a little bit about what we learned from the governor. Not a whole lot of new information. The big takeaway for me was that we're going to have commercial testing coming around soon, and that's huge.
Yeah, that's the big question. A lot of people wanted to know, how can we test for this? Are those tests available? Are there enough tests that will be able to go around? So we heard the governor during this news conference mention that he spoke with Mike Pence, with Vice President Mike Pence, and that commercial testing is set to go this week. But of course, the big question is, who should be tested? Should we all be getting tested? Or is this someone, if you believe that you have those symptoms, you should go get tested?
And listening to the whole press conference is our colleague here, Dr. Jim Diaz. Thank you so much for joining us from the LSU School of Public Health. Was that the takeaway for you too?
Yes, it was.
Okay, and what does that mean now? Now that we can have commercial testing, will far more people get tested?
Yes, that's very important. As it is, initially, we got the test kits from the CDC, and they were sent to state health laboratories throughout the country. But now, with commercial testing kits available, people will be able to go to their doctor, and if they're concerned or their doctor is concerned, they'll be able to get a test without having to go through the approval process with the state health lab. So the more tests are available and the more testing we can do, the better.
When people started to learn about the spread of the coronavirus that came initially, you know, it was something that was overseas. Now we're seeing it here in the States. People started to rack up on hand sanitizer, toilet paper for some reason, and cleaning supplies. So the big question a lot of people have here is, even though I don't show any symptoms, I've been out. I just recently told you I just left an airport. I traveled, even though it was within the States. For those who've been traveling, for those who've been in crowds, of course, we've had Mardi Gras recently here. Should we all be getting tested and taking advantage of commercial testing, or should we only go to our doctors if we experience any symptoms? What are we looking for?
Well, the high-risk individuals are people who've been to the epicenters of the outbreak: China, Italy, Iran, Japan, people who've been on a cruise ship that has had an outbreak. These are the high-risk people who should be tested, and their contacts. So everyone else should be practicing the proper sanitary hygiene and just practicing common sense, and they don't need to be tested. The high-risk individuals who meet the definition of a probable or a presumptive case, they're the people who need to be tested, and their contacts.
Before we get to the viewer questions, and we are getting a number of them, I had a question. During the press conference, you happened to turn and talk about, the first case was a 35-year-old healthy man.
Yes.
Notwithstanding HIPAA, and we all understand there's a need for privacy, are you surprised that all we know about this person is that it's a Jefferson Parish resident in Orleans Parish? We don't know a gender, we don't know an age, nothing.
Well, that's appropriate because we need to protect the patient's privacy. Under the federal HIPAA Act, we do.
So how do we know the other one was a 35-year-old man who was healthy?
Because that patient subsequently received medical care, and although we still don't know his name, the case was actually reported and published, peer-reviewed and published in the New England Journal of Medicine 2 weeks ago.
I see. So that's how we learned that person. Because I was thinking it was odd that we don't know a gender or an age to see if this person meets any of that criteria.
Yes, we know all of that. The 35-year-old male who visited
But we don't know about this person.
China. No.
We do know that this is a person who hasn't traveled into any areas that he could have been infected, or any areas that were at high risk. So, you know, just that possibility, or just thinking about that, has a lot of people alarmed as to how he might have possibly caught the virus.
Well, the virus is now being community spread. That means you don't have to be traveling to China or Italy or Iran or Japan to be exposed. You could be exposed here in the United States. You could be exposed to a person who has no symptoms at all, because we believe the virus can be spread as early as 1, 2, or 3 days into the infection before the patient develops any symptoms at all. And many patients may not develop symptoms at all and can still spread the virus. So that's a big concern.
So you could be a carrier and never a patient.
That is correct.
Okay.
Oh, wow.
We have a question here from one of our viewers asking about the possibility of water contamination. I don't know if this person has a child who's on a swim team, but they were asking about pools, spas, that nature. Can it be transmitted that way?
That's not a problem. The problem is transmission by respiratory droplets within 6 feet of a person who's infected. So the most important thing is to practice social distancing. The important thing about water is that you may need water to clean your hands appropriately, to wash your hands with soap and water if you don't have access to some of these alcohol-based sanitizers. And soap and water is actually preferred to alcohol-based sanitizers. You should only use those alcohol-based sanitizers if you don't have access to soap and water.
Well, you know, a big question that I've seen here from a lot of our viewers, and a question I had myself, I told you I was visiting in Cincinnati, Ohio, to visit my nephew who's only 1 month old, where there was a concern about him being in public, about us being in public and being in close contact with other people. And we took every precaution, taking off whatever clothing we might have had out in the public to make sure that when we held him, we were fine. But are children truly at risk here when you have someone who's that young, or infants at risk, or is this something that we just need to consider for the elderly?
Well, the elderly are at greatest risk, especially elderly with underlying medical conditions such as heart disease, liver disease, lung disease, kidney disease, diabetes. We actually think children may be somewhat resistant to infection. I'm not aware of any large numbers of pediatric cases. We're not exactly sure why, but we know that children experience a lot of coronavirus infections. There are actually 4 types of coronaviruses, so we know a lot about coronaviruses now. there are 4 types: alpha, beta, delta, and gamma. And the alpha coronaviruses and the beta coronaviruses are the only ones that cause human disease. The other 2 classes can cause diseases in animals, but the alpha coronaviruses cause 30% of common colds. And kids get common colds all the time. And they may be protected by cross-protective antibodies that tend to protect them. Also, kids are typically non-smokers. They don't have lung disease, they don't have heart disease, they don't have diabetes, they don't have any of those underlying conditions that predispose older persons to the disease. So that's a good news, that the children are somewhat protected.
Very encouraging. What about pets? You just mentioned the various types. Is this, forgive me, I was trying to follow as fast as I could.
Right.
Are pets susceptible? Can we transmit within the fur? Do we have to worry about our pets at all?
I wouldn't worry about your domestic pets, but I would point out that this is called a zoonotic virus, and that stands for the zoo, and it means an infection that originally came from an animal. And we presume, as in the other coronaviruses, the original reservoir was in bats, and bats infected other animals regionally, animals that were sold at the market in Wuhan, China. But now it's gone beyond that. Originally it was an animal infection. The animal infection was passed to a farmer or the animal raiser, and that individual then passed it to his or her family, and then it got to the general public by person-to-person spread. And now we've gone beyond person-to-person with community spread.
Now, you said that we've known about the coronavirus for a very long time. So we're seeing cases, now new cases have popped up in 4 in Illinois, 3 have been confirmed over in Ohio. Actually, they weren't confirmed yesterday, so I'm just learning about it today. 4 in Kentucky, 2 in Indiana. We're seeing these smaller numbers that are of confirmed cases that are being confirmed across several states in America. Seeing that this number is so small, should we be as concerned as we are? You think that there is a reason for concern?
Yes, the number is just going to increase as we do more testing. We'll find more cases. And these cases have to be, they're presumed initially, and then they have to be confirmed by a more specific test, and we will do that. The most important thing is to isolate the cases that are either presumed or confirmed, trace any of their contacts, and isolate their contacts for a period of 2 weeks before they can go back out into the general public.
A follow-up to that question, then, how much stock do you put into China's claim that they've peaked?
Well, I don't know how much stock we can put into everything that we get, because there was somewhat delayed in reporting the initial outbreak. However, there is a phenomenon called the epidemiological curve, and if they're reporting fewer cases, they may be on the downslope of that curve. We're on the upslope of our curve right now.
Well, I just got a question, because this is one of the big questions that we did hear. South by Southwest, a very popular festival in Austin, Texas. Expensive festival to put on, but also canceled. Some people are considering Coachella, which is a big festival in California. We are in the midst of, I think, our festival season. Jazz Festival coming up, French Quarter Festival. Some people are concerned about people coming from out of town into the city and the possibility of that spreading. Is that a concern we should have?
Yes, that's a significant concern, because the disease is spread by close contact within 6 feet of a person who's infected. And as you have events that bring a lot of people from states with a high prevalence of disease, Washington, California, then you have to be concerned that it could be spread at these events. And other countries have taken very significant steps. Saudi Arabian government has canceled the Hajj in Mecca.
That is a big deal.
Extraordinary.
Yes.
But we do want to reiterate that the mayor earlier held a press conference, and she said that right now all of our planned public events are still going on. So, you know, as soon as the St. Patrick's Day parade. So make sure you take your precautions. They did say, though, if you're elderly or you have one of these pre-existing conditions, just stay home as a precaution.
Right. I don't think it's a good idea at this point for people who are elderly or have any comorbid diseases, pre-existing diseases, heart disease, lung disease, diabetes. You shouldn't be taking a cruise right now. you shouldn't be going on a long flight to Europe right now. Let's wait till this, is over with.
All right, Doctor, you are wonderful. We hope you'll stick around and field more questions.
Sure.
If you're watching us right now, you see that number on the lower right part of your screen, 504-529-4444. Text us your questions. We are reading them as we see them right to the doctor himself. So thank you very much.
All right, Dr. Diaz, thanks so much. Earlier, before we started this new broadcast, Governor Edwards spoke about the first case just a short time ago. Let's take a listen in.
Good afternoon. Thanks for joining me and State Health Officer Dr. Jimmy Guidry and Assistant Secretary for the Office of Public Health, Dr. Alex Biu, and Interim Health Secretary Stephen Russo. Today, the Louisiana Department of Health confirmed the first presumptive positive case of COVID-19, commonly called coronavirus, in the state of Louisiana. The patient is a resident of Jefferson Parish and is currently hospitalized in Orleans Parish. In order to protect the patient's privacy, we will not be releasing additional details about that case. We've done 15 tests total. 14 of those have come back negative, this obviously being the only one that came back positive. The next step, and when it's underway, is for the presumptive positive test to be sent to the CDC for confirmation. This confirmation may take up to a few days to occur, but we are confident in the result of our tests, so we're treating this situation as we would a confirmed positive result. Keeping the individual in isolation, interviewing those who came in close contact with them to assess their risk and assessing what other precautions should be taken in the local area to reduce the spread of illness. We've been preparing for this moment for many weeks because we felt certain this day would come based on the information that we've been getting from the CDC and from our partners in Washington, D.C. I'd like to briefly speak about the coronavirus testing because I know that there has been some concern about who should be tested. Currently, Louisiana has several testing kits from the CDC in our state lab with which we can do several hundred tests as needed. We are confident the CDC will give us additional testing kits as needed as we move forward. This morning, I was on a conference call with Vice President Mike Pence and other health and state leaders, and we were told that commercial testing will go live across the country and in Louisiana this week. This is important because testing capacity is a concern for all states. Commercial testing means that more people who are sick will be able to talk to their health care providers about their risk and if they need to be tested, and certainly that is a good thing. Our role at the state will be to take any test that is presumed positive by a commercial lab, to verify it at the state public health lab before sending it to the CDC for confirmation. The verification will be important as these commercial tests come online. We have the capability to test hundreds of people, and it will only increase with the CDC providing more tests and with more commercial testing coming online. That said, you will begin to see the testing number go up for two natural reasons. First, we will conduct an epidemiological investigation of this presumptive positive case to determine the risk to the patient's family, friends, and those that they may have come in contact with. Some of these people may be tested based on their risk factors. Second, the state of Louisiana recently expanded its testing protocols to include a broader group of people. This means that if you have traveled to a country or region of concern or come in close contact with someone who has COVID-19 and are showing signs or symptoms of illness, and you have a negative flu test, you can be tested for COVID-19 here in Louisiana. At all times, our testing protocols have mirrored those of the CDC, and at no time have we not tested anyone who met those guidelines. To put this in context, the CDC reports at least 35 states, including D.C., have cases of coronavirus. Understand that the case in Louisiana has not been officially included in the CDC reporting as of yet because it has yet to be confirmed by the CDC. Close to 600 cases have been confirmed across the United States of America. Right now, the risk is still low for spread here in Louisiana and in the United States. We are obviously taking this seriously. and we've been preparing for this for many weeks. Last week, I held a unified command group meeting and created a COVID-19 task force to lead the planning for different scenarios as COVID-19 was spreading across the country and would almost certainly come to Louisiana. Our agencies are communicating with federal officials and with each other to ensure that we're doing everything we can to prevent the spread of illness. And certainly we need the people of Louisiana to be vigilant as well.
And at this hour, we have just been made aware, our partners at NOLA.com reporting that this patient from Jefferson Parish is being treated at the VA hospital in New Orleans. That is new information.
Yeah, we're going to talk more about that in just a second with Dr. Diaz. But for right now, let's go right back out to Mike McDaniel. He was there when Governor Edwards was giving his news conference. I mean, any new information that you're hearing from that, Mike? We heard it, and it seems like right now everyone is just taking serious precaution.
Yeah, and that's one thing that the governor was really stressing is that go ahead and take those precautions now, and that's what we really should be talking about in advance of all of this, because just like any other respiratory illness, wash your hands frequently, do it often, of course, and of course make sure you're doing it with an appropriate amount of soap and water, and also cover your cough. That's some of the big things that the governor was stressing, not just in regards to the coronavirus as it is now standing in Louisiana, but also just any other respiratory illness like the flu, where, you know, a lot of folks are experiencing that. So the tone here is one of seriousness, but the governor was reiterating several times that it's not a time for panic and it's not a time for hysteria, although a lot of people are.
All right, and the mood, the general mood was one of not panic, right? And just disseminate the facts as we get them, correct?
Yeah, exactly. And you mentioned before you heard from the governor, about all of those public events that we have coming up down in, New Orleans. I asked the governor that point blank whether the state was concerned about large gatherings of people, and he said that his task force that you heard him talk about will be evaluating that tomorrow. They're going to be meeting, and then he should have some proper guidelines in regards to that. Now, let's also talk about that commercial testing that you guys were talking about a little bit earlier. Now, here's how the state's role is going to go into that. If there is a presumed positive case from a commercial lab, the state will then do its own testing from the state lab. From there, it goes to the CDC to verify whether, in fact, it is a positive case of coronavirus. In the meantime, the state will be treating it as a positive case. They will be doing what's called contact tracing. That's making sure that they get everyone that has been in contact with that patient to do their own self-isolation or any other testing that they may need. From there, then, of course, the state will take appropriate action. Now, in regards to the testing, you heard the governor say that right now, several hundred people can be tested. The state has on hand, or got from the CDC or from the federal government, about 2,000 tests, but it takes several kits to do just one testing. So that has a lot of folks a little bit in confusion in regards to why the state have so many tests but can only test so many people, because it takes several kits to do just one person's tests.
All right, Mike McDaniel, thanks so much for that update. We'll check back in with you in a second.
Let's connect the dots, Doctor. We know from NOLA.com, they broke the story that this patient is being treated at the VA hospital. We know earlier from Mayor Cantrell, she had said that whoever the patient was went to the ER on Friday with pneumonia. What can we glean from that?
We can glean that it takes a significant amount of time, maybe 14 days, before the patient develops pneumonia with COVID-19. So we can assume that the patient may have had contact with many others, including family members, and they are contacts that need to be traced. They need to be isolated for a period of 14 days, and if they show no manifestations of COVID-19, they're fine. However, if they show any manifestation, they all need to be tested. Even if they're negative, they still need to be self-isolated for 14 days unless we have a confirmatory negative test. We really know the timeline of the disease because the Chinese actually released information on the first 1,000 patients that were treated in China. And we also know how the patients in the United States presented. So we didn't come up with the number 14 days out of the blue. The disease may begin on exposure day 1 and you may be totally asymptomatic, no symptoms other than just feeling malaise and not too good, not wanting to do too much. But then after about 2 or 3 days, you're still infectious and you can spread the virus. But the first symptom may be a scratchy cough, scratchy throat, and a cough. And maybe no fever initially, or a low-grade fever. And then an intermittent low-grade fever, 100.4, 100.6, never over. It's rare to get a very high fever with a viral disease compared to a bacterial disease where you could get a fever of 104. And then as the disease progresses towards the end of the first week, you begin to get more symptomatology, maybe even some diarrhea, which a few patients have reported. Then by the end of that first week and into the second week, you may get some x-ray evidence of pneumonia. So that would be in someone who's at high risk, like an elderly patient with pre-existing disease, lung disease, COPD, something like that.
Elderly defined as what?
Well, it's hard to define elderly. The traditional definition is 65 and above. However, somebody could be younger and have pre-existing conditions like COPD or diabetes or heart disease and would still be at high risk. The average age is in the neighborhood. The first patient, as we said, in the United States was 35 years old.
I was going to say 35 if you have any pre-existing conditions or the elderly.
Right. The average age is in the 50s.
Okay.
Low 50s.
I'd like to ask you a question I asked another doctor earlier, and that is, we're all healthy, we're fine.
Yeah.
But what if we're going to visit our parents who fall into that category? Should we not? Should we maybe just keep our distance even though we feel fine? Is it best to kind of just lie low for now?
Well, not really, but I should tell, your parents that this is not the time to get on a cruise or to take a long flight. But for you to go visit them, that's appropriate, but they're the ones that need to be counseled because they're the ones at the very highest risk.
So caregivers are okay now to go as long as you're feeling well. Okay, good.
The only concern we have for caregivers is if you're a caregiver of an exposed person or a presumed case, then you're the one that needs to be wearing a mask because you need to protect yourself.
Yeah, as we saw, and our partners at the Times-Picayune New Orleans Advocate just reported that the caregivers that are assisting the presumed case right now at the VA hospital, they are could be going into self-quarantine.
That's right, particularly if they weren't aware that the patient was considered a patient under investigation or presumed case and they weren't wearing personal protective equipment, then they themselves will have to go into self-isolation for 14 days.
And we talked about this a little bit while we were speaking with Mike or listening to Governor Edwards' conference, but just the fact that you can be the incubator here, you could be the person carrying this for 2 weeks, and you're not seeing any symptoms. That's what makes this much more scarier, I think.
Right. Well, we're very concerned about that because you could be infectious before you manifest symptoms, which was not the case with the original SARS.
Does the testing discriminate?
Infectious. Pardon?
Does it discriminate between, and this is another question I just had. We have 4 different strains of the coronavirus.
Right.
When you get tested, do they discriminate? Will they determine which strain you might have?
For COVID-19,
you may find you have one strain, but this is not the one that you should be concerned with.
We're testing for COVID-19, and well, that's the disease, and that's confusing because the name of the virus is called SARS-CoV-2. And it is related in a molecular sense to the original SARS virus that first appeared around 2003, 2004, 17 or 18 years ago. And it is a relative of that virus.
Is it worse? Because I don't remember this kind of coverage back then.
Well, we were very, very fortunate in the SARS outbreak because SARS came from Southeast China, and it came first to North America, Toronto, and to areas on the West Coast. And we never really had an impact from the SARS epidemic. It impacted many other countries, but and certain areas of the United States, and certainly Canada, Vancouver, Toronto, but we didn't have any cases here.
You
So we
dodged
were
that
very
bullet.
fortunate.
Yeah. Gotcha.
We dodged that bullet.
All right, Dr. Jim Diaz joining us right now. Obviously, we want to bring you facts and not fear. We're talking about the coronavirus. The first presumed case, the presumptive case, has made its way to Louisiana.
We're going to take a quick break and we'll be right back. We do expect that Vice President Pence will be holding a press conference, kind of updating the entire nation on efforts to combat the coronavirus.
Come Monday night, I'll be saying the weekend was way, way too short. And the work week is gonna be a long one.
I'm so tired, I'm gonna cry.
And cry like a girl.
What I need is an hour of laughs.
He's my friend. Best friend. Okay, look. Slow down a little bit, Dad.
It's a full hour of funny. A new neighborhood.
It's not as bad as what we had in '87 because we're down about 6%. Back then it was down 25%. But there's real panic. There's real blood in the streets now. And, you know, part of it's the coronavirus. Part of it's the oil price war. I think these oil prices have a way of really hurting us here. And that is the fact that for every dollar change in a barrel of oil, it throws off the Louisiana state budget by about $13 million. And then, of course, there's all the employment. Now, the industry's had a tough time for 5 years, but there's still a lot of good-paying jobs out there. And this really has the potential to push a lot of these oil companies over the edge.
Oh, well, Doctor, I just have this question. We have a couple of viewers who are having some financial issues. Obviously, people worried about their IRA accounts and their 401ks. And one of those questions is, I'm worried about my IRA account. I've already taken a big hit and having concerns about another. What advice can you share? Should people be panicked about this? What should they do in this situation?
Well, if you look over long periods of time, stocks outperform just about every other asset class, whether it's bonds or real estate or anything like that. But they're very volatile. They bounce around a lot. So the adage has always been that the closer you are to retirement, the more of your money ought to be in non-stocks, ought to be in bonds and things like that. In fact, one simple rule a lot of people used to use is for your retirement plan, you should have 100 minus your age in stocks. So that kind of puts it a little bit into perspective. But this does seem very difficult, and there is a silver lining here, and the silver lining is that interest rates have become incredibly low. So if you're thinking of getting a mortgage as such, you're at rates you'd never thought you'd see. And with gasoline prices coming down, those are going to be two boosts to consumers, but it is still very queasy out there.
And isn't this a great time to buy?
You know, my problem is a lot of people are saying that, and I don't think it'll really be time until everyone just starts to quiver a little bit more. That's worked every single time that you buy on the dips and such. But this feels a little different this time, to be honest with you. One of the big things is the U.S. government doesn't have much of a way to fix this, because if they can't lower interest rates any more than they have. They're almost at rock bottom. And the U.S. has so much debt now. We have $23 trillion we owe, and it's gaining about $1 trillion a year. So we don't have the money to really stimulate the economy. So I think that's what has people a little extra scared on this one.
So is this a dip or something much bigger?
That's, I think, what we're guessing. That's what we're trying to find out. Corporations' stock prices run on corporate earnings, and we're finding all these different ways that the coronavirus and the lower oil prices are going to hit earnings. And that's a big thing, though, is to think back. Stocks were really overpriced before this whole thing came about, so they're a little bit more vulnerable than we're used to seeing.
Well, I have another question for you. A lot of people asking now, is it wise to move money from your funds, or move funds rather, from your 401k at this time, or should we just write it out?
Well, the reason writing it out seems like a pretty good idea is that when people get out, they never get back in. And this is what we saw in 08, 09, where people got really scared, they sold off all their stocks, and frankly, most of them missed the 11-year rally that came after that. And so that's why I don't think anyone's ever timed the market. Timing the market is a fool's errand. So I think that's the part you have to watch for.
Arabia and Russia battle over oil and the ramifications it would have in our state, an oil and gas state. I mean, presumably the big companies are going to be okay, but would you expect to have some bankruptcy among the smaller oil and gas companies?
I really would. A lot of them have been walking on the edge of a knife already. They have a lot of debt. They've really been in difficult times. A lot of the companies that are having the worst time are the service companies, the people that have rigs, or they have pipe or helicopters or boats. They are really been strained, and they've been strained for about 5 years because it costs so much more to drill a well in the Gulf of Mexico, the Deep Gulf, than it does in these shale oil fields in Texas. And one of the reasons that the Saudis are doing this is they are trying to kill off the American energy industry up in those shale fields in West Texas. And so I think that's maybe one of the underlying motives behind all of this.
So at the end of the day, if you're looking at your 401k, and I would just plain old refuse to look at mine today, but is
Good idea.
Is the advice to stay the course? If you hadn't made a huge change before now, should you just stay the course, or should you try to shift into something more conservative?
I think it really depends on your risk tolerance and whether or not, like tonight, if you can't sleep, and there'll probably be a lot of us, it might be time to little by little whittle some things down to the point where you get comfortable. But the idea of wholesale selling and buying it all back later is usually something that doesn't work out.
All right, thank you so much. I mean, obviously, a lot of questions right now. I mean, you don't think about the fact that, you know, health-wise, how this affects you, but financially, our wallets are also taking a hit, and some of us are really concerned about what to do about this or how to move forward.
Right, and it impacts all of us on some level with the pocketbook, and then the trickle-down effects can have a silver lining, as we were talking about. You know, ultimately, the gas prices, as low as they are, will presumably drop even lower, and same with energy costs. So, but they said that will take about 6 weeks before we're going to see that hit our wallets. But so there are some silver linings to all of this. We are now about an hour and a half into our continuous coverage of the first presumptive case here in Louisiana, a Jefferson Parish person who is being treated, according to NOLA.com, at the VA hospital.
All right, right now we're standing by, still waiting to hear possibly from Vice President Mike Pence updating the nation on coronavirus and the coverage that they have to plan. Obviously, we just heard from Governor John Bel Edwards that the commercial testing, he spoke with Vice President Pence, that will start this week. So hopefully we can get more information as to what exactly that means and how this is supposed to happen move forward. We also have Dr. Diaz in studio. We're going to ask any questions that you might have. Again, you see that number right there on your screen, 504-529-4444. Text the word virus and give us your questions. If you want to have any questions, I know that some of us, some questions we've asked already, but I know a lot of us are concerned, and some people actually am getting more questions from those who are considered elderly or within that age bracket about what to do about future doctor visits. I want to avoid the hospital. Should I be visiting or speaking about certain concerns?
We'll have to discuss this with Dr. Diaz after we take a quick break. But again, a lot of people questioning about masks and again, water. If you missed the question about can this be transmitted in the water, this is the third one I've seen about somebody concerned about getting into a pool, perhaps their kids on swim team, you're okay. All right, so we're going to take a quick break and we'll be right back.
Well, can you explain your behavior on Princeton the other night? Hey, that's an assault.
Violence,
and
racial slurs,
kicking the door,
windows getting
rolling a
smashed,
bottle,
kicking him and striking him.
A night on the job turns into a nightmare for a local doorman.
They ended up putting a charge on the victim. Yes.
Eyewitness investigator Mike Perlstein uncovers how a bar brawl is raising questions about how state troopers handled the case.
The people was racist in their heart, and the trooper was prejudiced in his duties.
Tonight at 10.
I was hurt in a car wreck. I broke my ankle. I knew what to do. I called Morris Bart. He got me $175,000.
If you get hurt in a car wreck in New Orleans, do what your family and friends have done for many years. Call me now.
Member Janice L. says, I can depend on People's Health to answer the phone. I know I'm going to talk to somebody who seems to love their job. You'll love the People's Health customer service and the $0 monthly premium plans in all these parishes. So take the People's Health Challenge and compare your coverage to the long list of benefits in a People's Health plan.
Their press release. The city of New Orleans therefore moved very quickly to issue ours as well after having that conversation with Governor John Bel Edwards. What we also know is that positive or presumptive positive is now being tested by the CDC in Atlanta, and we do anticipate results within the next couple of hours. Once that is made, or once the results have been made, we will absolutely make you aware of the results at that particular time. However, our community, as it relates to our hospital community, is moving forward as if it is officially positive, making sure that they're taking the proper steps of tracing that will be necessary. What we also know is that the individual had no association with travel at all. So this is the only case of the illness in the state of Louisiana at this time. My administration absolutely is leaning forward on this and is prepared for the moment. As we demonstrated on Friday, having a tabletop exercise with multiple scenarios in which this one, it really is aligned. Our public safety team and public health leaders are working collaboratively, as we have been over the past several weeks, and of course, doubling down with the one case of illness that we know of. This includes leaders throughout the state. On the federal level, of course, the State Department of Health with the governor's office. The Louisiana Department of Health is leading the state its efforts in the response to COVID-19. And at this time, we continue to believe that the risk to the public remains low.
And that was the mayor updating the public on what we know, very little. However, what we have been able to learn is that this patient went to the VA hospital on Friday with pneumonia already. So you were saying probably they were first introduced to this 2 weeks beforehand, right in the heart of Carnival.
Right. If the patient was presenting with pneumonia, the patient is further along in the course of the disease, because the disease begins with an asymptomatic period and then a scratchy throat, and then maybe some abdominal cramps and maybe some diarrhea, and then more serious pulmonary findings, difficulty breathing, shortness of breath, and then potentially pneumonia. So that means that the patient is at least a week or so into the course of disease, or maybe even further into the course of disease, and has probably had other contacts with family members, with other contacts in the community, all of whom need to be traced and tested, and depending